before we begin. Thanks everyone for coming to the Newborn Screening Dried Blood Spot Collection Form educational webinar today. With Zoom, we do have everyone on mute as they've joined, except for the presenters. At the end, we will have time for questions, and at that point, you can unmute yourself by pushing *6 if you're joined on the phone, or if you're using your computer audio, you can click on the microphone icon in the Zoom window. If you also like to put your questions in the bottom in the chat box, we can read those as well. Luckily, doesn't sound like we have any audio echo, but if by chance you join by both your computer and the phone, we will hear feedback from that. So make sure you're using only your computer or the phone to join by audio. With that, I think we'll go ahead and get started. We are going to record this webinar for future viewing down the road. I do want to apologize. I have a little bit of a cold coming on, so I have a tickle, so you might see me stop to try to get a drink to keep going, but bear with me. Kim, would you mind start the recording, please?
It's going. We're now being recorded.
Again, thanks everyone for joining us for our revision of our dried blood spot card. Today we have myself, Joyelle, and Katie joining you. My name is Ashley Comer, and I'm the Newborn Screening Quality Improvement Coordinator at the State Hygienic Lab, which is located in Iowa, where the North Dakota samples are tested for newborn screening. Joyelle Meyer is also presenting today, and she is the Newborn Screening Program Director in North Dakota. And Katie Bentz will also be presenting, and she's the Newborn Screening Program Nurse Consultant in North Dakota. What brings us here today is we have worked on redesigning the dried blood spot collection form. Overall, the appearance is similar to our current card. We have updated the color to green instead of the brown, so you will see an obvious color change. And then we've also added additional fields and moved some of the fields around. You can continue to use your current cards that you have in stock now until they're all gone. And then as you order more cards, we will supply you with the new ones as they become available to us. In addition to the new cards, we also have created some education material that should supplement this presentation. There will be an educational fact sheet sent with the new forms, and this can be used to orientate new staff or refresher for current staff. We want to emphasize that the form is not just a form, but it really is a baby. So filling out that form accurately, completely, and legibly really could be a matter of life and death. We ask that you write firmly in blue or black ink to ensure that all information is transferred between all the carbon copies. Besides result interpretation that's required for interpretation of test results, it's also imperative in order to find and follow up on identified at-risk infants. Any delay in completing this form or trying to find out any missing information really can put the child's health at risk, and so it is extremely important, just as well as accurate collection, to fill out this form completely. The specimen submitter is legally responsible for the accuracy and completeness of the form. And also, we just wanted to remind you that there is a second ply that is included on the form, and that is for your facility's records to keep. On the new forms, there's going to be a couple new boxes that we wanted to make you aware of. In the bottom right-hand corner, there's a box that says place HL7 label within this box. Currently, there aren't any North Dakota facilities that use HL7 or health level 7 information or electronically order the newborn screening, so you can go ahead and leave this box blank. The box to the right then also says for SHL use only, SHL meaning the State Hygienic Lab, and please leave this box blank as well. This box is used when we receive the specimens here in the lab for our accessioning process in the newborn screening lab. And then on the top of the form is sample level information. And if we go from the left side, these boxes are the same. So there's a box for initial screen and repeat screen. The initial screen refers to the very first submission on this child. Repeat screen refers to any subsequent submission received after that initial screen. So even if the first sample is rejected due to poor quality or early collection or other reasons, this second screen is still considered a repeat. The program does test all submissions. The next box there is the collection date. So this has moved on the form to the top, and also the format has changed. So it's now going to be a 4-digit year, 2-digit month, 2-digit day. And this helps align with our LIMS system, or our lab information management system. The collection time then is followed by that, and it's in the same 24-hour clock. And the last box is the collector's information. So whether your facility wants to use initials or an employee ID number, anything that will uniquely identify that collector can be written there. Moving down the form is the infant information portion of the form. And here, the first field at the top to the right is the infant medical record number. Previously on our current form, it says chart number, and we've changed that now to request the medical record number. Here you can write the reference number that is meaningful to your facility when receiving results. The next field is the infant's last name. It's important to list the last name for the infant, even if there isn't a first name given. And with the last name, please record the last name the infant will go by at discharge. This helps the follow-up team locate and identify that child post-discharge when following up on an abnormal newborn screen. Providing an incorrect name could potentially cause delay in treatment and subsequently negatively affect that infant's health. The first name field follows that, and again, at time of collection, if the infant has a known first name, please record that here. We understand that this isn't always possible. So if the infant does not have a first name at the time of collection, please go ahead and leave it blank and send the form on. We don't want to delay the testing due to this. Then going down on the form is the infant's date of birth. Just like the collection date, the format is an 8-digit, starting with the year, followed by month and day. Infant's time of birth, again, is in the 24-hour clock. Next is the infant's gender. Please mark M for male or F for female in this box. If the gender is unknown or ambiguous, write unknown in that infant genders box. This identifying the gender can help us identify the patient when following up if there's not a first name available. Continuing on with the infant information portion of the card, here is where we've added some additional fields. We now are asking for the infant's street address. This really helps us locate the baby if needed, if they have an abnormal screen. So it's important to record where the infant will reside in order to locate that baby if necessary. Please write the full street address, city, state, and zip code. The next field is if multiple. So if this infant is a set of multiple births, so a twin, triplet, please record the birth order of the infant. This is also a change. Before on our current forms it asks for 1, 2, 3, etc. We're now switching this to be A being the firstborn, B being the secondborn, etc. If it's a single birth, you can leave this field blank, put a line through it, or cross it out. We did want to emphasize that this field is not in reference to the birth order of all pregnancies for that mom, but the birth order of this one pregnancy. Gestational age is the next field, and this is a field that is used for result interpretation. What we're interested here is gestation at the time of birth, so please complete this in whole weeks only. There's no need to round up. So for instance, if the baby was born at 37 weeks and 5 days, please just record 37 weeks. Accurate gestational age is critical for analyzing the results of newborn screening tests. This includes all collections, so initial and repeat, we do need this information. If by chance it is unknown, the gestational age, it's okay to go ahead and write unknown in that box. Next is the feeding method section. Again, this has moved a little bit on the form and some choices have changed slightly. Here we would like you to check all types of feeding that apply within the last 24 hours for that infant. So for example, if the infant has received both TPN and breast milk in the last 24 hours, please check both the TPN box and the breast milk box. Breast milk includes milk sourced from the biological mother as well as any donor milk. Formula includes all special formulas and additives such as human milk fortifier, protein, etc. Total parental nutrition, or TPN as it appears on the form, includes but is not limited to neonatal venous nutrition, or NVN, peripheral parental nutrition, PVN, hyperalimentation, starter TPN, or any other supplementation that includes amino acids. Again, different facilities call these formulas different things, so if your facility calls it something else, again, this is not all inclusive, so any additional TPN products not mentioned should be marked here. And if you have questions on that, always feel free to call either the lab or your North Dakota newborn screening program. If the infant is receiving fluids only and no other feeding method, please go ahead and mark the none of the above box. There isn't a need to mark if they're just receiving D10 or fluids like that. That would be a none of the above situation. Next, we have the current weight. And here we're asking for the infant's weight in grams at time of specimen collection. Do not leave this field blank. It's important to correctly record the infant's weight for accurate test results. Again, this is a field that is used for testing algorithms, and so weight at time of collection is imperative. Next, we have transfusion, and we're interested in transfusions before collection of the newborn screening and transfusion of any blood products. This must be filled out as yes or no, and this is used also for result interpretation. Transfusion can affect some of the tests that we screen for. If the patient by chance has received multiple transfusions, you can record the date of the most recent transfusion. So to the right, if the patient has received a transfusion, please list the date of the last transfusion. Transfusion includes all blood products, including but not limited to red blood cells, plasma, IV immunoglobulins, and platelets. Albumin does not affect newborn screening results. If a baby has received a transfusion before delivery or an intrauterine transfusion, please mark yes and record the date of that most recent transfusion. Next, we have a NICU box, which is on our current form, but we've moved its location. And then we've added a meconium ileus box. The NICU box, please check that if the patient's in the NICU, PICU, or other high acuity level care at the time of the newborn screening collection. If they are not, please leave blank. Meconium ileus is a bowel obstruction that occurs when the meconium in the infant's intestine is even thicker and stickier than normal meconium, creating a blockage in the part of the small intestine called the ileum. Check this box only if the infant has or is suspected to have meconium ileus. If no meconium ileus is suspected, please leave blank. The meconium ileus is known to interfere with the screening for cystic fibrosis, and if it is suspected, then the screening algorithm for the newborn screening for cystic fibrosis will change, and it's important for us to know that. Jumping down to the lower left corner, we have submitter information. We plan at the State Hygienic Lab to move to a new laboratory information management system, hopefully this year, and with that, the facility IDs are going to change for all of our facilities. So we decided to remove that field instead of going through the painful process of everyone relearning a new number. And we're going to start making pre-printed labels with submitter name and address and supply those to each of you when you order your collection forms. So you should be able to apply the pre-printed label to the top ply of the form. We ask that you don't share your forms or labels with other facilities, as this can lead to results being sent to the wrong organizations. The submitter information provided is used for result reporting purposes as well as billing, which is why it's important not to share and to have accurate and complete information. If you don't have a label at the time and you need to submit it, the fields are still available on the form, so please write the full name of the hospital, clinic, or midwife or organization that collected the sample, and please don't use abbreviations. Write the complete street address with the city, state, and zip code. This is really important now that so many institutions have the same name or are part of a larger affiliation such as Sanford. If Jeff Sanford's written on the form, it's difficult for us to determine what exact location we need to send a report to. If your organization requires satellite or clinic location samples to be processed through like a main lab, please put down the main lab information so we can make sure to get that report to the appropriate section. Also listed here below is an example of what the labels might look like. So it'll have a barcode, and in parentheses it has the 1. That will be the facility, new facility number. And then it'll have the line where your address will be, 1 line for address, and then city and state and zip code below. Another change is that we've added a sticker to the portion of the form that's retained by the submitting provider. So on that second ply, there will now be barcode stickers with the form number or the IA number. This can be used, 1/2 of it is to be placed on top of the birth certificate worksheet, and this will help ensure that the proper IA number is entered. And then the other half can remain on that form for your facility's records. And this is a clip out here. It'll say to remove this copy and retain for your records. And then you can peel 1/2 of that sticker off to put on the birth sheet worksheet. And here I'm going to pass it over to Joyelle, and she's going to continue on.
Thank you, Ashley. Hi, everyone. Thanks for joining us again. I'm going to continue on here with the guardian information, which is on the middle of the form. And the changes that we've made for this section are changing the mother to guardian. And if the biological mother is the legal guardian, please provide her information. I'll go through that in a little more detail. We added a box to determine the relationship to the infant, whether it's the mother or the guardian. And we added a section to capture the mother's maiden name for the birth match purposes. So we are doing birth match with our vital records to ensure that every baby born in our state has a newborn screening test. And if they don't have the test done, we're following up with the facility or whoever the specimen collector was. The guardian is considered the person that is legally responsible to care for the infant, and in most cases this is the birth mother, but it can include other legal guardian relations if the birth mother is not the legal guardian. So in the guardian box, you would either select the mother or the legal guardian, or the other box, and the mother is in reference to the biological mother. If the biological mother is the legal guardian, check mother. If the legal guardian is any other relation other than the biological mother, then we'd want you to check other. If other, please record the relation under the please specify on the line there. So if it's an adopted parent, human services, if they're going with protective services, a grandparent, or etc. So under the guardian's last name, record the last name followed by the first name. In the event of an adoption, please record the name of the legal guardian. So whoever that would be, the adoptive parent, adoption agency, or social worker. The accurate identifying information is crucial for contacting the guardian in the event of an abnormal result or if we need to have the baby retested. In the event that the infant will be held under protective services, record the name of the infant's social worker or legal guardian. The guardian's birth date. This would be, as Ashley said, in the 8-digit format, the year, month, and date, and then the guardian's gender. The phone number is very important for this section. So this is the one that we want to be able to contact them when, if something is abnormal with the baby's test in the case of an emergency. If the event, or in the event that the infant is held with Protective Services, record the phone number of the legal guardian or social worker. So whoever could actually would have that baby or have the contact for that baby to get him back into the hospital. Please make sure the number provided will be answered on weekends and holidays in case of emergencies. Accurate contact information for a guardian is important to ensure that the infant can receive follow-up testing and care in the event of an abnormal result. Please make sure the guardian's number will be answered on the weekends and holidays again. So the birth mother's maiden name, this is a new field also. We want you to record the birth mother's maiden name. In the event of an adoption or surrogacy, please record the birth mother's maiden name as it will appear on the birth certificate. I know that there's situations that may come up that you have questions on, and please always feel free to call us if you have questions regarding who to put down in certain circumstances. So this mother's maiden name section is going to be used for our birth match process. The healthcare provider information. So we added fields for the ordering healthcare provider and the primary care provider and the NPI number. And I know, I think it was this last year, the facility visit that we did in 2015, we talked about the NPI number coming. And so it's here, but we have some resources. And I know a couple of people from our facilities have shared the link with us, so I appreciate that. So I'll kind of go through, currently the forms request the attending healthcare provider, and the intent is to have the contact information for the healthcare provider in order to provide follow-up care if necessary. So sometimes this is the hospital provider, such as a NICU attending, and other times it's the patient is discharged and the program needs the PCP for the infant post-discharge. So we recognize that the facilities also have their own requirements and needs, often including the ordering healthcare provider for the testing and billing purposes. In order to meet everyone's needs, we tried to clarify and add an additional provider field. So now there's a provider field for the ordering healthcare provider and the PCP. And if they're the same provider, you can actually just check it the same as above box there. You can, let's see, every sample should have an ordering healthcare provider information, and we hope most also will have PCP information available at the time of collection. So as far as line by line, the ordering healthcare provider, last name followed by the first name and their phone number. And the phone number is really important, you know, for us to be able to reach that physician in the case of the emergency. In the event that an infant would be in protective services, record the phone number. Oh, I'm sorry, I'm going back here. Okay, primary care provider. So just put the phone number of the primary care provider. This information will be used to contact them if an abnormal result is found. Facility of birth. This is provide the facility of birth to help in locating the information regarding the infant or their provider in the event the infant cannot be located. Information is also important on the cards that are submitted by a clinic or other provider. So if indication of repeat screen and no initial can be found, have an initial screen. So the next section is the PCP's name on the bottom there. If the PCP is the ordering healthcare provider, check the box same as above. If the PCP is different than the ordering healthcare provider, please put the last name and the first name there. Do not write the name of the provider who completes rounds on the newborn in the hospital. Correctly recording this information is critical. The newborn screening program needs the name of the PCP in order to make sure follow-up of abnormal results is completed. And then we'd want the primary care provider's phone number, including the area code for their follow-up of any testing. And at this time, I'm going to hand it over to Katie.
So hopefully a lot of you have seen this. This is our new newborn screening educational brochure or infographic. So these are available through our website to order. We're hoping that you guys are using these to educate parents and guardians on the type of specimen that's being collected, collected, how it's being collected, the disorders that we actually screen for, which those can be found on our website as well, consequences of treatment and non-treatment, and also the retention, use, and disposal of the residual specimens after the testing has been completed. So there's also a video that parents and guardians may find helpful, and so there's a link for that video there at the bottom of the screen. It's called One Foot at a Time. I think in previous visits we had provided a DVD copy of that video, so your facility may have that available on site, but if not, the video is available online as well. The next thing is the update of our refusal form, which I know that we have talked to a lot of the facilities about these during our last facility visit, but this is found up on our website now as well. So if you need to fill out a refusal form, which hopefully you don't need to, but if you do, those can be found on the website, and you can download that PDF and fill that out and return it back to us. So under our law, parents and guardians are allowed to refuse the newborn screen for any reason, although we're hoping that with education they will not refuse the screening. So prior to the refusal, we do require that education is provided to the parent or guardian. This can be done through the brochure that we have available. There's also a little bit of information at the top of the refusal form itself. So families are required to complete this form if they're going to refuse the newborn screen. Once the testing is refused, the form should be completed and returned to us here at this stage within 6 days. And then a link for the form is there at the bottom of the page. So this form is what a family would use to request to have their blood spot card returned to them after testing has been completed. This is an option for families who may have thought that they wanted to refuse the testing because they didn't want us to store the blood spot card for them. So they may allow the testing to be completed if they can have the card returned to them. So this form, again, is also found on our website. They would have the testing done and then fill out this form and send it back to us. We do ask that if facilities know at the time of collection that the family is going to ask for the card to be returned, to make a notation of that on the card itself, either a little post-it or just a note on the card somewhere, to let the lab know that we are going to be pulling that card to return to the family, and so they won't put it in with the batch of everything else that's going to be stored. It'll just make it a lot easier for us to find the card. So the request for the access of the protected health information form would need to be completed and still returned to us at the state, and then we would find the card and return that to the family after it has gone through all of our process. So coming soon, a lot like what we're doing today with our webinar to talk about the dried blood spot form, we are going to be doing a monthly webinar series from our program to talk about a variety of different topics throughout the year. We're going to be looking at reviewing our website and resources that we have available, stories from families, the facility reports that we are working on updating right now, navigating through the database so that your facility would have access to the reports, disorders, history of the program, a lot of different things are what we're looking at doing. And these webinars would be recorded and posted to our website, just as we are hoping that with this webinar, it'll be recorded as well, and that link will be sent out. We'll be recording the future webinars as well. If there's a topic that you guys would like to know about and you aren't seeing that on this list, go ahead and email us. Our email address is there at the bottom of this slide. It's nbs@nd.gov, and we should be sending out information on the next webinar very soon, so keep an eye out for that. With that, this is a listing of our contact information for the hygienic laboratory, our follow-up nurses there in Iowa, and for Joyelle and I here at the program here at the state. So at this time, I think we are open for any questions, and I know that we do have a few of them in the chat box that we'll go through. Just a reminder that if you want to unmute your line, I believe it is *6 if you are on the phone. And Ashley, you might be able to help me remember where the unmute is. I think it's in the lower left-hand corner of their screen if they're through the computer.
Yep, right on the microphone icon.
So I think we could go ahead with the first question from Leona. Leona asked, do you want the first name to be blank or write girl or boy if they do not have a name at the time of collection? That's a really good question. And I think currently, I think we had probably years ago had said, if you don't know, maybe just put baby boy or baby girl. And I think that's often what facilities do. Ashley, I guess, what would you guys prefer in the lab that they do? Because to us, it doesn't really make a difference either way. But for labs, is it easier for them just to leave it blank? Or would you wonder if they forgot to fill it out?
I think it's okay to leave it blank if you're already writing the gender. It doesn't add anything, but it also wouldn't hurt anything if people write baby girl or baby boy.
So I guess
this is Julie from Fargo. We just have a question on the last name. We currently don't change the baby's last name throughout the NICU stay, and a lot of times don't know what the name will be. So is it okay to leave the mom's last name on there?
I would say that oh, go ahead, Joya.
You can go ahead, Ashley.
I was just going to say that if the legal name is not known, you have to do the best you can and record what you do know. But if you do know that the legal name is different than mom's last name, then we would ask that you change it. And just an example is if NICU is kind of a different situation because we'd be calling the hospital and you guys would, of course, know that baby's name. But if baby's discharged and they were born and mom's last name is Johnson, but their last name is actually going to be Meyer, when the follow-up team is calling looking for a baby Johnson to that PCP's office, they don't have a baby Johnson. And so it adds delay to us getting that baby in and possibly an emergent situation. So we're trying to reduce that as much as possible.
Okay.
This is Britta in Fargo. I think a good thing with that, as long as you give us the medical record number, we can connect it with their new name. So I think that will clear it up.
Sure. I think that from the follow-up, and I think Melody, one of our follow-up nurses, is joining us as well, as that again is just one more phone call that they have to make back to the hospital, possibly to medical records on a weekend. Sometimes that adds time, and hours truly can count with some of these disorders. So if we need to have that baby seen in the emergency room, we're trying to reduce that as much as possible. Again, it's not going to be 100%, but if you do know that the baby's last name is legally something different, we do ask for that information.
And this is Melody. And this is where the problem really comes. It's not usually a real big deal when baby stays within the same system. So if baby is born in the Sanford system and the primary care provider is in the Sanford system, or baby is born in the Essentia system and the primary care provider is in the Essentia system, I don't usually have a lot of difficulties matching a baby's birth name with a baby's post-discharge name. But when the baby crosses from one healthcare system to another healthcare system, say they're born at Essentia, but their primary care provider is in the Sanford system, the medical record number is of absolutely no use because the medical record number does not match in the two systems. So if you know that baby's going to have another name, hyphenate the name or put it in parentheses or do something that helps us identify what that baby's real name is going to be once they leave your facility. The other problem that we often have is once you transfer a baby out of your system, say to Mayo or somewhere, their name gets updated at discharge. And so I could be calling Mayo Hospital looking for baby Johnson and they don't have a clue in the world who I'm talking about. So
Yeah, this is Britta Anderson again. Just so you know, I don't think that will all go away, but we will try our best. And that, I mean, that's all that we can do with
and
that.
and that's all that we can ask, is that you do your best.
So the next question that's in the chat box here is asked about the stickers that were added now to the new forms. So they asked if a repeat test is completed if we're to disregard the stickers on the second page. And I would say the answer to that would be yes, because the stickers really are for the birth certificate, and by the time you're doing a repeat, that birth certificate worksheet has already been completed. So I guess for our purposes, we wouldn't need to have the stickers placed on anything. If you would need to have that number, on that sticker for a different record, you would have that available for your facility there, but it wouldn't need to be placed on the birth certificate again, as that had already been completed. And then someone asked if we are going to have the PowerPoint and handouts available, and we will have that available in just a couple of days. We'll make sure to send that out and have it posted on our website as well.
And I believe we only have the contact information. So if you shared the Zoom webinar, whatever, within your facilities, we'll only have the contact information for who we shared it with initially. So please be sure to distribute that and or share our link to our website, and then they can actually go there and find the link too. So.
This is Julie from Fargo in Sanford, and I have one more question. For those stickers that we're supposed to place on the birth certificate, in the NICU, we send a copy of the state screen to Family Birth Center because they're usually the ones that fill out the. Is that okay to just stick it on our copy that we send them? Because we don't actually deal with the birth certificate.
Do you send it on the copy of the actual certifier worksheet then?
So we send a copy of the state screens that we do to Family Birth Center so they know that they've been done. So can we put that sticker on the copy?
Well, the sticker is actually on the copy that I think you're referring to. That's the one. I think that's the one that you would. That's the one that you actually keep for your facility. So the sticker is on there. So they would just need to take off one of the sides, because the sticker, I don't know if I can, this is an example of a South Dakota form. Let's see. So there's actually two sides to the sticker here, and only one side is pulled off. So I think that would work just fine. Yeah. So only one side needs to be removed, but I would think as long as they're filling out the birth certificate worksheet information, that would be fine, as long as they know to put that on the certifier worksheet. And I know that in speaking with Vital Records, they don't actually get any of the hard copies of your forms. So this is mainly for your data entry. So whoever is putting it in, the birth certificate worksheet and information into the system so that Vital Records gets that, it's mainly just to decrease the error rate, because we've had some difficulty with maybe some spaces between the IA number and then the numbers. And so we're getting a significant amount of unmatched babies, and our Vital Records department has to manually take each baby and look back and forth, and that's why the names and date of birth are so important. So we're just hoping that having this number on there for that data entry person will decrease with those errors. So I hope that cleared
Okay. Yeah, thank you.
Welcome. Are there any other questions?
Yeah, I have a question. This is Sarah in Fargo. We, in the Family Birth Center, we send a lot of our babies home, especially ones of first-time moms, and they have no clue who they're going to see as a primary care provider. So we're just curious as to what you want in that spot then.
I guess if they don't have any clue, I guess they wouldn't complete it. I think part of this is, and we're actually going to be doing a webinar coming up this year on prenatal education for newborn screening. And so one thing we really want people to be thinking about is who are they going to have for their PCP when the baby is born? And I know that's something that first-time moms may not have any idea about, but I think it's important to start these discussions when they're pregnant. They can talk to other moms, find out, who may be I guess, who they would want, kind of similar personalities or whatever. But I think that if we can start that conversation earlier, and I know that's not always the case, but I think that we could maybe have some of those answered. What we don't want to happen is a doctor listed on the card that we should maybe contact, and they end up being on vacation for 2 weeks, and then Melody is calling, the facility who puts her through to 3 or 4 different people, and it's a time critical disorder, and we literally have hours to get this baby back into the facility, and maybe they're 2 hours from the nearest birthing facility or ER. We don't want any bad outcomes from this. So do the best that you can. If they know the number or the name, then have them put it. If they don't, I guess I would just leave it blank. But I think part of that is going back to our OB clinics and the nurses in there that are providing education to just kind of know more ahead of time and just ask those questions. So,
Sure.
And
So leave it.
They may not have a specific provider picked out, but maybe they know the clinic that they would like to see. And I would say, if that's the case, maybe put the phone number for the clinic, and that would at least cut down the time a little bit.
Okay. So if they don't know, don't check that box for same above. Just leave it totally blank.
Yep,
Well-
or draw a line through it or whatever you would like to do.
So,
Okay.
so this is Melody again. So I guess I would say the solution to that, from my point of view, is if they truly don't know who they're going to take the baby to, it becomes absolutely critical that we have a valid phone number then for mom.
Okay.
Because if I can't find a primary care provider and that baby has an emergency result, I need to be able to pick up the phone and directly call mom and say, you have to tell me the name of a doctor that you're going to take this baby to, or you need to be able to meet a doctor in an emergency room. Who do you want me to give this newborn screen result to? So if they cannot provide you with the name of a primary care provider, then you all need to make sure that the phone number for mom is a working, valid phone number. Because she will be the one that gets the call. So I know one of our hospitals in Iowa was having a similar problem, and the solution that the nursing staff came up with, all on their own, not at our prodding, but this is what they thought of, was that if mom really didn't know who she wanted to take baby to, the labor or the maternity unit had a list of pediatricians, and they would help mom make an appointment for the very first baby check before the baby was discharged. Okay. And then that way they could assure themselves that at least if there was a problem with the newborn screen, there was a doctor connected to that baby. And that actually ended up working really well for that facility.
Okay. Yeah, we used to have a list up here, but with the doctors changing and getting busier and their practices closing and stuff like that, it's hard to keep up with that. So
yeah, I had a doc a couple of weeks ago that I called, and he'd retired in like November.
Yeah. Okay.
And the mom didn't know.
This is Emily in Jamestown, and I have a few quick questions. Kind of minor questions, but I know my staff will ask. For the medical record number, we have the E in front of it because of electronic. I'm assuming you want the E because we do use that on most forms.
Sure, whichever is going to be meaningful for you guys when we send results back on the lab report for you to match up in your system.
Okay, and then you also said to don't abbreviate on the name of the hospital. We have a little bit of a long name and it will not fit in there. So what do you advise us to do?
Well, hopefully you'll be able just to use the pre-printed labels for the majority of it. And again, just do the best you can in writing it out. If you have to use some abbreviations. What I don't want, and the biggest fear is for just to say something like Sanford. We screen for 3 different states. So Sanford, we have them in Iowa, South Dakota, North Dakota. And so if that's all that's written, it's nearly impossible for us to really determine where it came from.
Emily, I would recommend just to put Jamestown RMC or something like that, because then they know there's not another regional medical center. There's not another JRMC, but maybe there is in Iowa. But I think if you just put Jamestown and then RMC, because I know that's, it wouldn't fit on there at all.
Okay. And then I had one other question and I can't think of it, so I can email it if I think of it.
Yeah, if anybody thinks of any questions after, we end the webinar and they would, like to email us, just email us at that mbs@nd.gov and we'll make sure that we get the questions answered.
Or I'm sure you guys have our phone number too, so we don't mind phone calls either.
Yep.
So I hope that you guys found this helpful, and if you have any additional questions, make sure to let us know. And we hope that you can join us in April, and we'll send out the date and time as soon as we decide that. We are hoping to have our webinars start around 12:15 to 12:45, just a 30-minute webinar. Katie was talking about those, to allow people, if they have a lunch from 12 to 1, to get their lunch and then go back to work. And so I think we're going to try to set a specific date, like the second Tuesday of every month at 12:15 or whatever, just so that it's easier for you guys. And if you don't have staff that can attend, we'll have the webinars recorded. But is there any other questions? One more chance.
And the forms will be, we haven't actually got them here at the lab yet. They should be shipping next week. So again, we also still have some forms, about a month's worth on hand. So you might, if you call here within the next couple of weeks, you will probably get old forms. We're going to use those all up until they're gone. And so there will be an overlap of when you might have old forms and new forms, and we will be okay with receiving both in our system right now. So feel free to use the old forms. And again, when the new forms go out, we also will have printed education as a reminder, because it might be a couple months before your facility sees the new forms, depending on the frequency. So this might not be as fresh in your head with all the other duties you have in your job.
This is Britta in Fargo. I have one more question. So if we have a locum physician that is at our facility, then we just register them at that site that you had given us on the presentation. Is that correct?
I guess I'm not, in terms of their MPI number, or?
Yes.
You shouldn't have to register them. So each provider should have their own unique identification number, which is what that MPI number is.
Okay, so they come with that.
Yeah.
Yeah. It's
All
a
right.
national number. It's not something that we in North Dakota assign them or anything. And if you have troubles finding the MPI number, if you go on that website and you can't find them, I would maybe contact your billing department or your lab, because I think that they have the MPI numbers there as well. So, and Ashley, did they need to provide a list of their providers with the MPI numbers to you guys? Or is that something, I can't remember if we had talked about that.
I would just wait to hear on that.
Okay.
And I know that we did that. We were contacting our billing office for them. I was just curious about the locums.
Okay. They should have one assigned, I would think. So
it's kind of like a social security number. Everybody, all the physicians will have their own unique number.
Okay.
That's assigned to them.
They have to have that in order to prescribe treatments and medications.
Yep. Thank you, Kim.
This is Emily in Jamestown. I remembered my question, and we've dealt with this the last 3 transfers that we've had. We do the early collection because that's what we were directed to do. However, then we usually put a sticky note on telling Iowa that that is happening, but I don't know if it's not getting, the information's not getting passed on. Is it okay to write in an empty spot on the form? No one early collection due to transfer?
Yep, so the information probably does get through. It's just that due to just automated systems, that the computer will automatically fax any early collection. So no matter what you write on there, it's the computer still sees it as an early collection. And so that will continue to happen. So if you get a fax that says, is this an early collection? Please correct any information. We were getting a large volume of early collections that weren't true early collections, and it in fact was just a typo or a written error. And so they can go back and correct that in a timely manner. But if it's a true early collection and another one needs collected, you can just disregard that fax and move along. You don't need anything back from it. Sorry about that. The automation provides, I know, a little bit of confusion, and
This is Joyelle again, and since we have everybody on the line still, I just wanted to let you know that Katie and I are still going to continue to do our facility visits every year, in addition to these webinar series. And we are developing with a few other partners from some different facilities. We're developing a newborn screening toolkit, and so it'll have, for example, different model policies, collection information, and all sorts of things that you can use for your orientation of new staff and or refresher for staff. So we're going to have that hopefully by this summer. We also are going to plan next year for another newborn screening conference. And so if you have any ideas of things that you'd like us to present on, or even topics like maybe some national presenters, please get in contact with us. Maybe it's specific disorders, like if you're working in the pediatric unit, maybe you have a lot of babies with congenital hypothyroidism and you want to learn more about that. Or if your providers always have questions with cystic fibrosis or the coordinated treatment center or whatever. If you'd like more information, we are in the process of trying to figure out who our speakers will be and what topics. So we'd love to hear your feedback on that too.
And this is Melody, and I'd just like to address, there is a little bit of redundancy built into our system with the early collections and the poor qualities. And so, yes, it is true that when the lab, and by lab, I mean the state hygienic lab, and they are located about 2 hours away from where I am located. So when they get an early collect or a poor quality, immediately when that specimen is received and they notice it's an early collect or a poor quality, there's an automatic fax that gets sent back to the submitting facility. And then there's a little bit of time delay built into the system, and to allow the submitting facility to respond and maybe clear up any times when those are not really an early collection, like the birth date was wrong or the time of collection was wrong or something. If that doesn't happen in a really kind of timely fashion, a day or so later, I get to see that there's an early collection or a poor quality screen out there. And then that's when redundantly sometimes I start calling and trying to verify, are those real early collections? So I apologize that redundancy exists, but it really is for the protection of the baby.
Another thing that I was going to say is those notes are nice, that while the automated doesn't take an account, I can make an internal comment saying, like if you know where the baby is being transferred, that I can put on the lab side a comment saying this baby was collected early due to being transferred to Jamestown or whatever the case may be. And then follow-up can see that, and then that also saves them a phone call and possible delay in finding that baby, because they don't have to call the submitter to have you guys say, oh, that baby was transferred. And then if you have where it's transferred, she can just call directly there and we can get that baby treated as soon as possible. So know that those notes are still used. If you write back on the fax or even the sticky note, we do use that information and put it in a comment for communication. It's just not something that will stop it's still considered an early collection, and so a fax is automatically generated.
And I love those notes, so don't stop using them.
Well, we don't want to keep you guys too much longer. Thank you guys so much for your time. If there's, I was going to say, any more questions, feel free to share them. Otherwise, get in contact via email or phone with us, and we would be more than happy to address any questions or concerns. We really do appreciate you guys taking your time. We know that this is just one part of your job, but it really is an important one, and thanks for your time.
Thank you.
Guys so much.
Thank you.
Thank you.